Hi, Norma. Young Timmy came home from school with a cough yesterday, and today he has trouble breathing and a high fever. He probably has pneumonia. I'm going to spread mustard plaster on his chest to rid him of the symptoms.
What? You will only burn him, and you could cause stomach and kidney damage. We should start antibiotics and then refer to the doctor for the next step.
No, we needed to know his blood type and other relevant medical information first. We will begin the process of ridding him of the infection right away and ordering antibiotics, and then we will refer to the doctor.
What are antibiotics?
The doctor will order the antibiotics, and you cannot decide what they need from their blood type.
Yes, you can. And we have the autonomy to work by ourselves, not under the doctor. And blood type does determine the type of antibiotics.
As you can see, the past, present, and future of nursing will affect the outcome of this patient's treatment. Today we are going to discuss important topics in each tense. The past tense is the foundation to the basic knowledge and skills of nursing. Instruments and locations couldn't be sterilized as thoroughly as today's standards, posing a potential danger to the patient, doctor, and nurse. Similarly, poor training and education of nurses resulted in poor patient care. Nurses in a private practice took on a large amount of responsibility. They were quite often required to live with families, taking care of 1 to 4 patients at a time. During this time, they were required to take care of their patients, but to do so, they would have minimum contact with the family and be as little of a hindrance to them as possible. In a hospital setting, nurses had far fewer responsibilities, often assisting in minor ways, or as secretary or other menial staff position. Again, nurses were meant to do as they were told, and to do so with as few people noticing as possible. Nurses were not intended to be well-educated individuals. All that was required was that they had practicality, common sense, and belonged to the female sex. Therefore, most learning was done through apprenticeship and on-the-job training. This allowed old beliefs, such as that the doctor was to be obeyed without question, and nurses were to do as they were told, to last many years.
Now that we have taken a look at the past of nursing, we are going to explore the present state of nursing. Looking at the nursing present, due to advancing technologies, nurses are expected to receive higher education. Nurses need to update their knowledge and skills to ensure quality health care for patients and to minimize possible health hazards in the workplace. The performance of healthcare workers, such as nurses, is inevitably affected by the pace of technological changes and the need for constant updating in relevant medical information and the acquisition of new technical skills. The high speed of advanced practice nursing, the need to control healthcare costs, appointing tasks to unlicensed personnel, and educational preparation are the key issues in nursing today. Failure to keep up to date may result in poor patient outcome and injury to nursing staff and/or sick leave. As a public safety issue, it is important for nurses who are in the frontline healthcare workers to have sufficient up-to-date knowledge and skills to maintain and improve practice performance and quality of care. What hinders the nursing staff from getting education? Well, probably the first and foremost is financial difficulties. Secondly is their families, taking care of their families and themselves. A nurse with young children put in usually 16 plus hours a day between working and taking care of their families. Thirdly, for a newly graduated nurse can be very intimidated about the whole job experience. That takes us to the mentoring program, a group of trained and experienced nurses pairing up with the new students and/or new nurse.
Now that we've taken a look at the past and the present state of nursing, we're going to take a look into the future. The Robert Wood Foundation and the Institute of Medicine have recommendations on what the nursing field is going to have to do in order to take on the future demand of nursing and the quality of care. They have 3 recommendations. The first recommendation is to increase the nursing education that is currently held. The suggestion is to increase the number of nurses who possess a baccalaureate degree to 80% by the year 2020. They also recommend that they double the number of nurses who have a master's or a doctorate degree in nursing. The Mayo Health System has already started this process. They are starting to only hire nurses who have a baccalaureate degree, and there are nurses who do have an associate's degree. They are encouraging them, if not helping them, to get their baccalaureate degree in nursing. The second recommendation is to support nurses to practice to the fullest extent of their training and to develop and maintain a culture in which nurses are full partners in the healthcare process. The higher education that we just talked about will only be useful if the nurses achieving this higher level of education are allowed to use it to fulfill their potential. The state regulations permitting or forbidding advanced practice nursing is largely uneven throughout the United States, and often regulation does not permit advanced practice nursing for nurses to practice to the fullest potential of their training. This will increase the cost efficiency by giving the work to the lowest paid level of the system who is trained to do the work. The last recommendation is to collect superior workforce data, because this report did not have anything that related to quality. Where does this leave quality? They asked. The report does not indicate that increasing the tasks completed by those with less training will or will not increase quality. The report should recognize that all positions are important and that removing any one position from the system would greatly diminish quality. So, in conclusion, you can see why the nurses from the skit earlier were very confused about the diagnosis process, the treatment, and who was their supervisor. The past of nursing focused on the lack of education of nurses, the incredible difficult and different working environment, and just that the specific tasks of the nurse. The present state of nursing focuses on the increased education, the need to keep up the facilities and the processes. And then it is recommended that the future of nursing improve the nurses' education, let the nurses practice to the fullest extent of their training, and collect superior workforce data. As you can see, there is a theme of education throughout the entire history of nursing. The profession has progressed from no education to associate's degree, and now they are requiring a baccalaureate degree or even more in nursing. The future of nursing will have highly educated nurses, and through technological advances and education, the nursing profession will soar.